I've been officially told that we are going live, so, you know, you can continue to talk non-business, of course, but, you know, certainly the public will be able to see and hear anything we're saying from this point forward, so that's what I've been.
Probably would want to start the meeting or not have any conversation since it is on the YouTube channel.
Yeah. So we have that awkward silence until we actually start, right? Technology.
Well, everybody's joining promptly at 7 o'clock.
Well, I've got one.
We do have a quorum, so if you want to start, I mean.
All right. Well, I'm going to call the December 10th, 2020 Board of Health meeting to order. And before we get into the business, I need to read a statement. Until further notice, meetings of the Board of Health will be held electronically, with the majority of the members participating via remote access in order to comply with the State of Illinois Gubernatorial Disaster Proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to citizencomments@skokie.org or by mail to Village of Skokie, attention Michael Charlie, Director of Health and Human Services, 127 Oakton Street, Skokie, Illinois, 60077, or via the Village's Dropbox located by the public entry to Village Hall. And with that said, I'll call it in order for business. And we're going to do introductions in just a few minutes, but we just learned the other day, yesterday, that one of our members, Dr. Abib Abbasi, has passed away recently. I think you're all well aware of that now. You've gotten the email. What I'd like to do is ask for a moment of silence in memory of Dr. Abbasi. So if we can do that for the next minute or so. Thank you. Dr. Abbasi, Mr. Abbasi was a longstanding member of the board, and what I appreciated about him was that he always spoke up, and he always spoke his mind. You know what he was thinking about, and he contributed, I'm sure, at almost every meeting. I'm a relatively new person on the board, but if any of you want to share any memories of Mr. Abbasi, Dr. Jackler?
Mr. Abbasi was one of the most positive people that I have met. He was always upbeat. He was always involved. He was involved in the community. He was always willing to volunteer. He played an active role in directing, questioning, and promoting the Board of Health. And we owe him our gratitude for the amount of time and energy, and I wish condolences to his family. I'm sure that they will miss him because we will miss him.
Yeah.
No, I agree. I agree with Dr. Dracker. I would sit with him, as you guys know, and he was always positive and forward thinking. He always told me also to speak out a little bit more, but I'll try to do it on his behalf. But he did a lot for the community, his community, the Muslim community. A lot of organizations that he started a physical therapy unit in one of the mosques, and he was very active, and we certainly are going to miss him. And I just found out with everybody else a couple of days ago as well. So yeah, he contributed very nicely and very effectively to the Board of Health, so we are certainly going to miss him. Thank you.
Yes. Please go ahead.
Yes, I'm Rohit. I was not aware of that Miss Dr. Abbasi passed away recently. I, for some reason, did not get the email. It was shocking news to me, but like Dr. Reckler and Rommel said, he was totally involved in our meeting each and every time. And my condolences to him and his family.
Well, and to follow up on that, I think we should really send some sort of card to the family on behalf of the board. And there's been some discussion also of making a contribution to the mosque that he was so instrumental with. Hello? As a tangible expression. We're getting reverb. If you could put your mic on. If you could put your mic, turn it off. Does that help?
Whoever on iPad 3, I think needs to mute. Mike, I don't know if you can mute.
I have tried muting it.
The host of the program should be able to mute everybody's mic. Whoever's got the host position.
I am going to try to mute everybody. Just give me 1 second, I gotta figure out the service.
All right, is that controlled now?
You're not echoing now.
Yeah, we're not, okay, great. Okay. All right, as I said, there's been some discussion about a card and some sort of memorial on behalf of the board to the mosque. Is there any discussion about that?
I believe that that's correct. I will tell you that I had a habit of attending the wakes and the funerals of the members of the Board of Health over the year, as many as possible. And I regret that COVID-19 is preventing the proper tribute to Mr. Abbasi. And I think that doing something in regards to making a contribution, and of course, sending condolences is most appropriate.
All right. Well, I'll work offline to accomplish that on behalf of the board. So thank you. All right. We've been using a consent approach to approve the agenda and the minutes. So does anybody have an item they want to extract from the agenda or from the minutes? If not, we'll accept both as published. Seeing none, they are accepted. I think because we have Mr. Charlie here as our first meeting, it's only appropriate that he give a little introduction about himself, and I think we should also introduce ourselves, just our name and how professionally we are related to the board, so he can begin to match faces and our names, even though we're here virtually. Eventually we'll get there. So Mike, do you want to tell us a little about yourself?
Sure, I can, Dr. Warner. So, again, Mike Charlie, I've been here, this is my 4th week with the Village of Skokie, and I'm really excited to be a part of the team here. My previous position was with the Village of Oak Park, where I was the public health director for the past 5 years. Prior to that, I worked for the Village of Oak Park for 17 years. And then I was also with the City of Evanston for 6 years before that, and DuPage County Health Department for 2 years before that. So I have over 25 years of experience in public health. I will say that I have a master's in environmental management through the Stewart School of Business, although I certainly have worked with most of the different divisions and departments that currently the village of Skokie has, including the communicable disease and environmental health and vector control and things like that. I have past experience with, so I feel like it's going to be a pretty comfortable transition to being the health director for the village of Skokie. I did really quickly, I also have a bachelor's in environmental health through the Illinois State University. I did want to say that just really quickly what I feel like a Board of Health means to me, just to express this to this group. First of all, I have a lot of respect for anybody in the community that's willing to volunteer their time for a board or commission. Not everybody does it. It takes a special kind of person to want to do it. When I was at the Village of Oak Park, I had a real close relationship with all of the Board of Health members, and it almost went beyond just the meetings we had once a month. We worked on so many things together, including Tobacco 21 and other ordinances and other things to move the agenda forward on public health issues. I feel like it's just that added resource, a value-added resource to the health department, having a group of professionals that are willing to take time out of their day to provide recommendations, advice, not only on public health issues, but on just programming and education and just some of the things they see in the community, because you are our eyes and ears. I mean, you're community members. So you see what's going on in the community, many of you longtime community members. So I really respect the Board of Health. I value the Board of Health. And my past experience with Board of Health members has been really, really positive. So I'm really looking forward to getting to know all of you and getting to understand what some of your suggested goals, objectives, and things are within the community. So I want to thank you for welcoming me and look forward to getting to know more about all you also.
Thanks, Mike. We've already had a little chance to talk last week, so I'll skip introducing myself again. And Trustee Bromberg, do you want to introduce yourself?
Hi, I'm Trustee Bromberg. I've been a trustee for almost 20 years now at the village. I really respect the members on the Board of Health. I think they've done an amazing job over the years. I myself am a nurse, and I work for the Illinois Department of Financial and Professional Regulation, overseeing the department as a nursing coordinator in nursing regulation. The state of Illinois has 130 nursing education programs, and we oversee all the nursing education programs from LPN, RN, and we license APRN, but we don't oversee those education programs on the graduate level. I also oversee the discipline of the 120,000, it's 220,000 licensees. We do discipline also, policy, and also I oversee the nursing workforce center to make sure we have enough workforce here in the state of Illinois. And unfortunately, with the pandemic, that's getting harder to handle in the state. But everything, we're doing the best we can. So that's pretty much sums up what I'm doing.
Thank you. Dr. Dreckler, do you want to say anything further? You have to unmute.
It's a few things. It's nice to see all the members of the Board of Health, some of the new members that I have not gotten to know because of COVID-19. I pretty much said that I've practiced obstetrics and gynecology for over 42 years. I worked in Skokie for 25 years. I've been a member of the Board of Health for 21 years now and was chairman for 10 years. It's a terrific board. I was a practicing obstetrician gynecologist, and now that I've retired from clinical practice, I mainly teach residents and students once or twice a week. So welcome, Mr. Charlie. I believe that you're in for a fun time.
Okay, and I'm just going to go across with the names that I'm seeing. Some people have numbers, and so I hesitate to call your number, but Pat Urbanis? You have to unmute. We'll come back in just a minute then. Yeah, Dr. Williams?
Hello, it's a pleasure to meet you virtually. Mike, welcome. And Larry Williams, I'm a full-time faculty member at Midwestern University, but I had 30 years of service in the United States Navy and was a public health emergency officer for Navy Region Midwest for 3 years. And I actually planned to help put together the plans for pandemic back in 2006 to 2009 for the Midwest. And we were very well prepared at that time before politics got involved. I'll just leave it at that, not go any further. But it's a pleasure and look forward to working with you.
And Dr. Williams is our local expert on all things tobacco. So, Pat, Pat, are you online now? Are you unmuted?
Try. Can you hear me?
Yeah, we can.
Okay. My name is Patricia Urbanis. I am a nurse and a nurse midwife by education. I've been doing this for over 50 years and worked in many clinics and many hospitals. And I attended the School of Public Health at Columbia University. So that's how I am interested in serving our community.
Thank you. Mr. Pandya?
Thank you. I didn't know how to change that number to my name, so I see my number is 107519. But I'm sure someone will tell me in future and I can correct the name for future. Hi, my name is Rohit Pandya. I'm a board member for the last about 12 years or so. I'm a pharmacist working at Walgreens in Morton Grove. I retired in October, so now the retirement, and we're doing the virtual meeting, but it would be wonderful if we can see each other at the meeting every month like we used to. But I'm sure that will come soon, and hopefully the vaccination would work.
Dr. Vernon? Mike Vernon? Mike?
Sorry, I was just having some difficulty unmuting myself. So my name is Mike Vernon. I am an epidemiologist. I'm a former colleague of Dr. Drackler from North Shore University Health Systems. I am currently working with the Illinois Department of Public Health as an infection control consultant, and my responsibility is primarily for COVID-19 mitigation in congregate settings throughout the state of Illinois.
And I admit, I know Mike Vernon, so I know I've probably talked to you on the phone before, and I've
Yes,
heard
we
Mike
have,
talk
Mike.
on a million IDPH webinars. So Mike, he's doing a great job with the state. And when I found out you were a board member, I was like, is that the Mike Vernon? So I am really happy that you're on this board, and I hope that if I make any mistakes today, I'm sure you could jump in and talk on my behalf. So about COVID.
That will not be necessary, but thank you very much for those
Thank you,
kind
yes.
words, and welcome
Yes.
to Skokie.
Mike, are you back in Skokie or are you still in Belize?
I'm in Skokie now.
Oh.
I came back. I came back just before Thanksgiving.
Good. Glad.
Working in autoimmune research, autoimmune disease conditions and research. And I will be the liaison to the South Asian community and been a Board of Health member for the last 5 years.
Thank you. I see somebody's name, Bruce. I don't know if Bruce, I see you, but I don't see another Bruce. Do we have one?
It might be Dr. Gaines.
Yeah, that's me.
Okay, all right.
Bruce Gaines. So, hello everyone. Nice to see everyone. And Mike, welcome to the board. I'm an associate professor of ophthalmology at Loyola, and I have a joint appointment at the VA. I'm an optometrist. Been with the board for, it's been many years. So I would like to welcome you to the board, Mike, and just wish you all the best and success in your position. So thanks for your effort and time to help out.
Thanks, Dr. Gaines.
Yeah.
All right, I think we've introduced everybody now, and again, as part of the welcoming to Director Charlie, he now has the task of giving us an update on where we are with COVID in the community, and in the area and in the state. So, Mike?
Yeah, let me set this up. Hold on, let me go Zoom. I will be sharing this.
Unmute, please.
Okay, so I'd like to provide an update on COVID-19 and some of the planning we're doing with COVID-19 in the Health and Human Services Department. First, I'm going to provide some information on COVID-19 data as it relates to the village, an update on the COVID-19 vaccine planning, and then I'll provide some information on the village's point of dispensing planning to the group. So the latest data we have, which is also available on the village's Skokie COVID data webpage, and I have provided the web link there, and certainly can provide this presentation to the Board of Health later, is that we have 3,659 Skokie resident cases. This includes those residents testing positive via PCR testing. We haven't included the antigen testing within this number at this point. There have been 54 deaths, unfortunately, and our 7-day moving average is right around 45 cases per day, meaning that over the last 7 days, we've had approximately 45 cases we've had to respond to and conduct contact tracing per day. So we do calculate our positivity rate based upon state data, and one of our challenges with state data is sometimes we just don't have up-to-date data. So I think Bruce may have updated this a little further today, a couple days further, but I believe that right around November 8th, we were around 15% positivity rate. So that is high, and that is a positivity rate that the state was seeing across the board around that time. And I have some charts I'll show you on the next coming slides that'll sort of provide a little more information and something maybe you can relate to as you look at our trends and data. But I will say that we do receive daily data reports from the Illinois Department of Public Health that provides for positivity rate. We will be meeting with the state epidemiologist, one of them tomorrow, to have a discussion about that data. So I'm going to provide what they had provided as of December 8th, which is more recent, was 8.3% positivity. Again, I think that you'll see if we look at our trends, we sort of went up through November, and then the state shut down through Tier 3 mitigation measures, and then we saw the number of positive tests and our positivity rates start to decrease, which is really good news, and hopefully we continue to see that trend as people continue to follow social distancing and Tier 3 measures. So this chart right here is a chart that provides our daily case count and our 7-day moving average. It's pretty obvious by this that we had that sudden increase. I think I can speak on behalf of every health department in the state of Illinois that the sudden increase through the beginning of October through the middle of November was surprising, because this is a novel virus, right? We really don't know from month to month, day to day, where the data is going to head for sure. And we were sort of coasting along at a realistic and manageable number of cases per day, and then it exploded. And it is certainly, I mean, we were prepared for it. We hired contact tracers through a grant we received, and we've been doing well. But the data does show that we had that sudden increase, and we've started to see a decrease in the number of cases recently, which is good news. This right here is our number of tests and our positivity rate. November was our largest month, not only for tests, but for positive cases since the onset of the pandemic, which is alarming and justifies the governor's reaction to implement or those tier 3 mitigation measures throughout the state, and certainly warrants the public education that's going out not only through the Skokie Health Department, but also throughout the state. The contact tracing. So the Health and Human Services Department is conducting contact tracing. We have some very well-trained and professional staff. We have some very prepared and well-trained supervisors. We are responding to reported cases within 24 hours the best we can. We also not only doing contact tracing, but we're working very, very closely with the schools, with our businesses, with our long-term care facilities, providing for consultation and support. Since I've been here, I had a meeting today with the different superintendents. This is like my third meeting in the last 3 to 4 weeks. I've had weekly meetings with District 219. So we are actively engaged within the community and assisting them with decision-making on COVID-19. So the vaccine update. So this is what everyone wants to know about. So we know there's the 2 vaccines. We know there's Pfizer and Moderna. We know that they received the approval today. We know from a webinar that I attended from 3 to 5 p.m. today that we are expected to receive just a little over 800 doses of Pfizer vaccine shipped to Highland Park Hospital, where we will be providing a majority of that vaccine to Skokie Hospital, and a portion of that vaccine we will start to vaccinate our tier 1 personnel, including our paramedics primarily. And if we have sufficient vaccine, we're going to start vaccinating the people who are going to be working in our point of dispensing operation, including our Skokie staff, including our medical reserve corps that will be volunteering, including our Oakton Community College nurses that will be assisting with administration of the vaccine. A couple things we know about the vaccine. You know, if you've been following this, you probably already are aware about the 2 doses, and Pfizer having to be the second dose 21 days after the first, and Moderna 28 days, and the fact that they say that there's a 95% effectiveness of it, and that the effectiveness will be something that will be seen about 7 to 10 days after the second dose. The good news is that even though 5% of the population may not be protected, that 5%, if they're vaccinated, they're saying that they will still see less, they'll be less symptomatic. So hopefully even that 5%, if they're not fully protected, there is a layer of protection in regards to the symptoms. The vaccine will be allocated to jurisdictions based on population and priority. So this first shipment is going to be based on the top 50 counties and their death rate, like based upon population. So we are within Cook County. We do meet that qualification. Again, the vaccine is going to be administered over many, many months. This is going to be a marathon. It's not going to be a sprint. Our plans, and I'll go in a little more on our pod planning moving forward here, but our plan is to vaccinate in community point of dispensing in an operation, our first responders, employees, and the public. So we hope to vaccinate approximately 38,000 of Skokie's 63,000 residents. People may ask, well, that's not 63,000, and we understand that. There's a calculation that I didn't share with the Board of Health tonight, but once you remove the the long-term care facility residents, which we have, and these are some of the things that happen on the back end that nobody ever hears about the Health and Human Services Department doing, is that Claudia Braden, our excellent emergency preparedness person, had reached out to all our long-term cares so we have the 6 long-term cares and 31 group homes, and have them signed up to receive vaccine directly from Walgreens. So that will lessen our load and also decrease the number of people we have to vaccinate. Now, our goal is to vaccinate 38,000 residents, but we may vaccinate more or we may vaccinate less depending on demand. So if you look at the state's vaccination plan, 3.0 is what it's called. It's the third version. It talks about vaccinating in tiers or in phases. There's actually 4 phases. The first phase is broken up into, or the first tier is broken up into three different phases. So 1A, 1B, and 1C. So the goal is that with the limited amount of vaccine we have, is to vaccinate those people that are most at risk. And sort of, it's like a tiered approach where the first responders, long-term care facility residents, paramedics are going to be sort of in that first phase because they're the most at risk. Healthcare personnel working directly with patients, obviously they're the ones who we want to vaccinate first. We will be shipping sufficient vaccine for them to get started. I've seen 20 emails where I've been carbon copied on between Claudia Braden and the person who's administering the vaccine, not administering, but organizing the vaccine at the hospital, where there's like, they keep on asking, how many doses are we going to get? So we finally found out today how many doses we were getting. So we're going to work it out where we ship just enough for them to vaccinate their staff within the next 5 days, or 5 days after, within the 5-day time period, because it's not coming ultra cold in this first shipment, it's coming thawed, which is important. So again, phase 1B is going to be our additional frontline workers, our MRC, the Oakton Community College School nurses, our library, and education. So our library has said that they have staff that will volunteer and help us. And then education is something else they've lumped into 1B, although I think that our plan is going to work with the schools, the private and public schools, to get them the vaccine, and hopefully their nurses will be able to vaccinate staff at the schools. Again, to go through the phases, adults with high-risk medical conditions, obesity, cancer, diabetes, heart disease, and those over 65 will be phase 1C. Moving on to phase 2, now we're starting to see larger amount of vaccine. So people are asking about timelines. Well, our guess is we're not going to have sufficient amount of vaccine until the soonest the end of January. Probably February, March, April is when we're going to open up that larger point of dispensing operation, and I'll provide a little more on that in a little bit. So phase 2, again, is workers and industries and occupations important to the functioning of society, and they're listed there. And I want to go back to this too, is that the state has insisted and urged all of the local health departments to follow this plan and not deviate from it. So we're going to try to do it the best we can. Phase 3 then, children or individuals under the age of 18 have not been approved by the FDA to administer this vaccine to, because there hasn't been sufficient testing yet, that and pregnant women. So this first phase, or the first couple phases when we have the vaccine, until there's approval, we're only going to be vaccinating adults. But in phase 3, we hope to have that approval and hope to be vaccinating children and young adults. Young adults being the last, because persons 18 to 30 haven't really, there isn't as much risk with them acquiring significant disease or outcomes of disease. And we've seen that. Most of our deaths have been persons over the age of 60, which are our primary group. And then finally, phase 4 is, okay, we have a ton of vaccine, let's open the doors, let's get everyone through and vaccinate as quickly as possible. So pod planning. So we have had, since I've been here, we've had several internal stakeholder staff meetings. We have been, and I will say that prior to even those meetings, we've been drilling and exercising in public health for years and years and years. We probably know way more about setting up a pod and vaccinating large numbers of people, as evidenced by, in 2009, we had the H1N1, which I was at the village of Oak Park at the time. But we know what we're doing. It's just a matter of getting police, fire, public works, the village manager's office involved, and having them understand the logistics and what their responsibilities will be. So we did visit 6 or 7 locations this week, and we've narrowed it down to a couple that we think will work best, and we're going to set up those relationships, because it's either going to be at one of the schools or at a park district facility, or potentially there's the theater that's up north on Skokie Boulevard and Oakton that we also visited, that there may be a good space. But more to come on that. We don't know for sure where we're gonna have them yet. We're not 100% sure. And when we do know, we're gonna be pushing out information to the public using our social media. We do have a partnership with Oakton Community College. Their nurses will assist with vaccination. What else do I have to tell you about the vaccine? I attended a 2-hour webinar, really interesting, today from the state. They've been slow to get us like really fine, like minute in the weeds details. They gave us a ton today, really not for the first time, but really a lot about how it's going to be shipped, how we have to, tracking temperatures with both vaccines are super, super, super important. How to store the vaccine, how to monitor the vaccine, the fact that we have to be registered with eye care, and other just in the weeds things about process we learned today. So prevention is key. The last thing I wanted to mention with this presentation is, until we have a vaccine, we're still going to continue to push out the message to the Skokie community, and so will the state, about wearing your mask, watching your distance, and washing your hands. And really, that's just public health 101 that we've been trying to push since day one of this pandemic. So with that being said, I hope I covered most of what I wanted to cover, and I didn't skip anything, because I wasn't really looking at my slides and reading off it. But if anybody has any questions about our planning process or what we're doing, I'd be more than happy to answer any questions.
Something that goes along with the vaccination program is having adequate PPE. And that was an issue early on in the pandemic. Is that going to be provided for during the vaccination process?
So yeah, I mean, we received shipments of PPE back earlier this summer and spring. We have a ton of it. We have face masks, we have N95 masks, we have thousands and thousands of surgical masks, we have gowns. We will also, in addition to that, the state's going to send out, along with the vaccine, they're going to send out the syringes, they're going to send out the needles, they're going to send out some PPE. So we will have sufficient PPE for our pods. Certainly if somebody from the public walks up without a mask on, we'll be able to offer a mask to the public when they walk into our clinics.
Well, thank you. That was really quite reassuring to me in terms of where we're headed very shortly, it sounds like. Other questions for Mike?
I have a question. When the first vaccine is approved, it's been on its way, how are you going to manage the second vaccine that will be approved hopefully early in January? How are you going to coordinate between the two vaccines? Who gets what? Who gets the second one? How do you then determine who gets the second vaccine if you haven't gotten the first vaccine?
It's a great question. So there's a system called EM-Track, and there's also a database called iCare. So the state has said that they will have in early January EM track ready for use around the state, where people will be able to register for you know, a 15-minute increment or 30-minute increment, and like pre-register, and we will then be tracking which vaccine we give to each person, and this system will remind that person of the need for a follow-up visit and to register. And we will be using not only that system, but what we have in iCare and what we have in our records to ensure that, I mean, to be honest with you, I'm hoping that we only receive Moderna, because it doesn't have to be stored at ultra cold temperatures, and we can store it in the basement of the health department. So if we do end up receiving, and we've had discussions on this, Dr. Drackler, about, you know, how are we going to do this? And I think we're prepared to navigate through that, so that those individuals that receive the first dose of Pfizer are going to get a reminder to return to the point of dispensing operation to get a second dose of Pfizer. And we will have the documents on site. If we have two different vaccines, we'll have two different lines of, we plan on having up to 15 lines of service at our larger location. But if it's Moderna, you're going to go to line number 6. If you're going to go to Pfizer, you're going to go to line number 12. So it's going to be a little bit of a logistical nightmare, but we've already started discussing that, and we'll have procedures in place in order to accommodate that once we know what we're getting and when we're getting it.
Thank you.
Can we go back to the Hollywood Squares presentation so I can see if anybody is raising their hand?
Okay, I gotta figure out.
I have a question.
Go ahead.
I think I'm just thinking of the community perspective. I was just talking to a friend, and there's just so much people still don't know if they want to get the vaccines. And do we have any, really easy to understand materials that we can share with the community about the vaccine and the recommendations, and just something lay language that we can help spread the word in the community?
So what we can do, we can share the frequently asked questions that the state has provided on their webpage. I'll look to maybe see if we can provide a link, not only in our messaging, but also on our webpage. I'll have to look, you're looking more for like, I think the frequently asked questions are pretty well prepared, where anybody reading them would get a better idea of what the vaccines do and what method of delivery for the vaccine and things like that. So, what I'll do is I'll look in to see what we currently have on our webpage and see how we can introduce that into our messaging.
Also, Skokie is so diverse and different languages spoken in Skokie. So something, I guess, to think about is if we could translate any of these materials and have it available for the community.
Okay, sure, of course.
Ed, you have a question?
Well, I actually more of a plea. Again, this comes out of my work with the Medical Society, but there is a tremendous amount of misinformation and distrust throughout the United States, unfortunately. And when we just did a survey of physicians, and we had a very robust response. And I can tell you it was sobering. Even amongst the medical community, there's a lot of concerns regarding the safety. Tonight, we just did the first kickoff for our town hall meeting on this subject to, in ways, try to educate our colleagues because we want them to be the ambassadors. When we realized that about 30% of the physicians were reluctant to even offer it to their patients, which is an extraordinarily high number. And I'm assuming the Skokie is no different. And we've been lobbying the state. We had a delegation meet with Senator Durbin, to get the federal government to get on board, because an education campaign needs to go out, and it has to be effective. And regardless of the language, I'm going to make a proposal, and this is right from my heart. But I think that the members of the Board of Health have to be ambassadors for this. And if we need to educate each other, let's do so. But we should be getting out and talking to the community in some way, above giving out a pamphlet. Because I'm not so sure that there's the written word that will be interpreted adequately. We have to maybe even have sessions just to answer questions for people. There's so much, as I say, there's so much mythology. I spent a good part of the Q&A dealing with one particular doctor that was convinced that an mRNA fragment, which is, again, you understand that this is a laboratory manufactured mRNA fragment that codes for a very specific protein in the spike protein region on the virus, that he's convinced is mutagenic. And it biologically can't be mutagenic, but if this is how people form their own ideas. And we haven't even touched on the anti-vaxxer movement, which is increasingly damaging in this area. So, all good intention. What do they say? The road to hell is paved by good intentions. I think we have to be prepared for this, and that's just my plea.
Yeah, no, thank you. Dr. Williams, you've had your hand up. You have to unmute.
Yeah, thanks, I got it. Hey, what I want to let you all know, in case you didn't hear this, but a lot of the communities now are working with people in the minority areas, especially religious leaders, which we've actually worked with here in Skokie with the Board of Health before. Some of you may not know this, or some of you may remember this. And to get the word out, I'm sorry,
That animal doesn't.
Mom's coming home. But we should call together, Mike, if you can. I strongly recommend that you do this. Call together community leaders from the different community resource centers in the area, the Assyrian centers, the Indian centers, areas that have community leaders that can go back and disseminate this data. It's much better than pamphlets. It's much better than us. It needs to be, I hate to say this, but I mean, it needs to be people of their own ilk in order to get for the believability of the message to be better. I know, Ed, you've worked with the medical community, and you see what it's like with educated people, that supposedly are supposed to know this, but they don't. And that's unfortunate. But a lot of the other areas in the United States are working with community leaders to do this, and especially, from the areas that people know what's going on. So if you could call something like that together, it'd be really great, and get the word out.
Yeah, and the Board of Health is blessed with having those ties to the community. And an issue in terms of vaccination is that there'll be equitable distribution to all communities. That'll be another challenge. But something we talked about last month was, does the Chamber of Commerce have a role here? We had talked about it in terms of the masking when people go into various businesses in the area. And the Chamber might be someone to include as well, because people are coming in their stores and asking what's going on. So I think there's much opportunity here, some great ideas. Other questions? Mike, will the private physician offices play a role in the vaccination process?
That's it. Well, it's a great question and something I missed. I missed on communicating. So the plan in the beginning here is for us to receive the vaccine and for us to administer it. But the plan, especially when the vaccine is approved for children, is hopefully by then the providers will be receiving the vaccine themselves in the Walgreens and the CVS's of the world, and they'll be able to start administering the vaccine directly to the children and other members of the community. So that is the plan, but just not at first. from what I've been told. So, for sure.
Thank you.
Can I comment, one of the things we've been concerned about is that a lot of trust has been giving to major institutions, hospitals, to distribute it to their medical staff who are at risk of being exposed to the infection. What's missing in the equation, though, is there are a lot of community-based physicians, especially working in multi-specialty, clinics, FQHCs, et cetera, which haven't been considered, and they're the ones often making the initial diagnosis and having initial exposure to these patients. And our colleagues in infectious disease are seeing a number of these providers and their staff, the nurses, becoming ill, probably at a higher rate than doctors in a hospital, because hospitals seem to have this under better control, better ventilation, many different reasons. So I don't know if that discussion has come up, but I suggest that, we're pushing on that button. But I'm wondering, when you start meeting with these state authorities, to remind them of the fact that the point of entry for a lot of sick patients is not the hospital or the emergency room. A lot of it is the community practices.
That's a great point, Dr. Lynn. Thank you.
All right, well, are there other questions? Well, thank you, Mike. This was very informative. Under my report, I just want to say thank Mr. Bruce Jones for filling in for the last couple months as the interim director, and we give him a little applause for a job well done holding us together. Thank you, Bruce.
Thank you, everyone. I appreciate it. But I'm happy to return to my environmental health supervisor role, and I'm also very happy that Mike's on board. So,
Yeah.
appreciate that. Thank you.
Yeah.
Thanks.
I just want to say I've known Bruce forever, and I was when I was accepted for this position, I was really looking forward to working with him. He's a great guy, and he's really helped me with the transition. So I'm very appreciative of everything Bruce has done.
And Mike, something that we may want to think about for a future meeting, and that is the impact that the pandemic is having on mental health. I've been on a couple web calls now where it's sort of like an iceberg. We've got the pandemic with our numbers here, but what's the impact in terms of emotional and mental health, and what's going on with substance abuse? Would it be helpful to have somebody one of the providers in the community come to a meeting and just talk about what's the impact, where people can't have their direct contact with their therapists, and how is it being provided electronically? I think it might be very interesting because, like I said, I think that's the hidden part of this whole epidemic is the impact on emotional well-being and behavioral health.
Yeah, I'm really interested in getting to know the mental behavioral health community better here in Skokie. When I was in Oak Park, our last community health needs assessment, we partnered with the Community Mental Health Board of Oak Park Township and River Forest Township's Mental Health Committee. So, and I got to know them very well, and I think that oftentimes public health departments don't do enough to collaborate with them. I'm not saying Skokie hasn't, it's just that I'm very interested in getting to know that side of the community better, and I think that'd be a great idea, Dr. Warner.
Do you have anything else for the director's report? You've really given us a lot of information, so it's fine if you don't.
I think we have I'll say just one or two things. It sounds weird to say that. I've only been here 3 weeks. I really am still getting to learn a lot of the programs within the Skokie Health and Human Services Department. I will say that I would say our priority is COVID-19, so obviously I could certainly update you on a lot of that, but I will say that, and I'm trying to grab my paperwork because I thought I printed something out on this, but, we have our Assisted Family Program. There are 2 dates in December here where we will be giving out, I'm going to get this number wrong, and I don't want to put it in the minutes, but it's like over $30,000 in gift cards to very, very needy and families, that deserving families. And it's really a great program that is run through donations from the community. So if anyone that donated to that, I just want to really thank Skokie for being so very generous for that. I do know that we also are providing for utility and rental assistance through our Human Services Division. I do know that the Human Services Division has done a ton of work within the community with different populations, and certainly identifying those populations that are being adversely affected by COVID, and including reaching out to seniors and helping them with just cope with this and just ensure that their mental well-being is being taken care of. So I know there's been a litany of other things that I wish maybe by next month I'll be able to communicate better on some of the things we've done. But outside of that, I just want to again thank everyone, and I really look forward. I mean, I know the meeting's not over, but certainly, I mean, my update would be I really look forward to getting to know each and every one of you better and serving the village of Skokie as the Public Health and Human Services Director.
Great, thank you. And again, it'll be great when we all get together in person. Is there any old business for this evening? Any new business? Well, seeing none, then before we get to adjournment, I just want to wish everybody here healthy and happy holidays coming up. I know it's going to be a different time, and we're all going to be doing things differently, but we need, as I said, the light's at the end of the tunnel. We just need to barrel through the next several months to get there.
And
So,
Dr. Warner, is it okay if I mention one quick thing? And I'm
Sure.
not sure if, I know that in the, just recently, that the Board of Health had discussed banning the sale of flavored tobacco products. So if you'd like, we can discuss that at our next meeting and talk a little more in detail about maybe next steps and how we get a recommendation to the village manager's office / mayor, so that the Board of Trustees can then provide a recommendation in regards to or amending our local ordinance to ban flavored tobacco products. So just wanted to mention that I'm happy to work with the Board of Health on that. I think it's a very important initiative, especially right now with vaping increasing especially amongst adolescents and teenagers.
and I have to say, that was something very close to Dr. Abbasi, to Mr. Abbasi as well. He was very passionate about the whole subject. So with that, is there a motion to adjourn?
Dr. Warner, I just want to make a comment. I did check. There are no citizen comments. I checked I was able to log in from where I'm at. There are no citizen comments at this point in time.
Yeah, thank you for reminding me of that. It's very important. So, seeing no objection, we are adjourned until our meeting then in January.
Okay.
Thank you very much.
Nice meeting everyone.
Thanks, everyone. Take care. Stay safe.
Okay.
Bye.
Okay, so we can close this. Close this. Close this. Close this.